Good afternoon, everybody. Thank you so much, Dr. Omar, and the great panelists. Great thanks to the International Hospital Federations for having me today speaking about the real value in healthcare, which is the clinical excellence. Actually, if we try to think about the possible care pathways during the patient care journey, we can find three possible pathways. Two of them are very bad. The first one of them is the defensive medicine pathway, with both perspectives, the positive one or the negative one. And the second one is related to the medical errors, either diagnosis-related surgical errors, procedural errors, maybe technological failures, medication errors, or even never events. But here we have only one good pathway. The good pathway is going through the right clinical care. The right clinical care, which is based mainly on the evidence-based practice. Evidence-based practice actually is the background of our clinical excellence framework. Evidence has proven that clinical care systems must be strengthened to face challenges while we are maintaining and increasing the health services and health status of populations and their quality of life. Actually, this strengthening should be based mainly on two categories of concepts. The first category is related to clinical governance, and the second category is related to operational excellence. From there, a simple and straightforward approach has been chosen to design an integrated, phased, and agile clinical excellence framework. The main theme of this framework is right clinical care at all levels of care, all the time, in a well-managed system. This framework is mainly originating from three origins. The first origin is the very well-known the Baldrige criteria for performance excellence, with its 7 pillars of implementations, 3 plus 3 plus 1. The first 3 are the effective leadership, aligned strategy, and customer focus. This should be integrated with the workforce development, management by operations, and results oriented. All the time, it should be having measurement, analysis, and knowledge management. The second origin is related to clinical governance, 7 components, which are the clinical effectiveness, risk management, patient involvement, information management system, clinical auditing, staff management, and education and training. And here we come to the third origin, which was published by NHS, which is the clinical excellence, including passion, diagnostic acumen, professionalism, communication, knowledge, skillful negotiation, and scholarly approach to clinical practice. So here we come to the clinical excellence operation framework. Actually, it is built on 4 pillars. The first one is the right clinical care related to the process of care at all care level, related to the place of care. All the time here is related to the measurements process, and in a well-managed system, which is related to the system around the system of clinical care. Common components of the framework all over the framework include development of required policies, development of required templates and forms, creating the measurements and comparisons at a local level and even at the national level. Then we'll go to improvement and innovation, which is the stretch mechanism of the framework. When we talk about the first pillar, which is the right clinical care pillar, here we need to talk about, it includes the dimensions of who is providing the care, how the care is being provided, and when the care is provided. Who is providing the care? It includes credentialing, privileging, competency development and assessment, and then we'll go to the distribution of the healthcare professionals and their workload. Then we come to how the care is being delivered. Here we are talking about, of course, about evidence-based practice. It includes national guidelines and protocol, the international guidelines, how they are adopted and adapted, and then the clinical care standards, how they are developed and adapted. Then we'll go to when the care is being delivered, and this is related to the urgency level of care. It includes 4 services. We are talking here about waiting time and waiting list. Includes ED or ER emergency services, OBD, OR, and ambulance service. When we talk about the second pillar, which is at all care levels, here we are talking about the place of providing the care. And here we have 2 main dimensions. The first dimension is qualified facilities or organizations for clinical services. It includes staff, equipment, spacing, and supportive services to call this place as qualified place to provide such a service. Then we have the second dimension of this pillar, which is integrated care with clear accountability levels. Here we are talking about moving or transporting or transferring or referring the patient within the same facility or between different facilities, within the same level of care or between different levels of care. Then we go to the third pillar, which is all the time. And here we are talking about measurement. We need to measure the clinical effectiveness through clinical auditing against clinical care standards. Then clinical patient safety, and here we need to develop the reporting system for the patient safety incidences and measuring the related behaviors to patient safety. Then we'll go to clinical patient experience, the related measurements like surveys, like satisfaction, like patient experience measurements, and redesign the service accordingly. Then we'll go to the stretch mechanisms, improvements and corrective actions and continuous innovations accordingly. The fourth pillar is related to in a well-managed system. Here we are talking about the system around the clinical care system. Here we have first the claim management and how the payment system and reimbursement system is designed around the appropriate care, the effective care, the efficient care, and the patient-centered care. Then we'll go to information management, which is supposed to be detailed, integrated, comprehensive, and well-governed, enabling the system of clinical care. Then we'll go to disclosure and transparency, and last one, but not the least, of course, is proactive control. The implementation approach of this operational framework goes with 3 main points. The first one is the phased approach with the well-defined priorities. The priorities are coming with quick wins, like low-hanging fruits, also high impactful steps as related to incidents reports, patient experience reports, and also the priorities are coming with Vision 2030. Also, the second point is related to stakeholder engagement at all levels of care, including policymakers, leading entities, healthcare organizations, and healthcare professionals, financiers, and sponsors. The third one, and the third important point is start simple, then go advanced. You can start manual, semi-automated, automated, and advanced, automated, and more complex. The impact of such a framework is going with clear accountability, better continuity of care, better clinical patient safety, and proper utilization of resources, better patient experience. And the most valuable 2 products of this framework are, the first one is related to the National Clinical Decision Support System. The second one is the National Clinical Performance Registry. My last take-home message here, that evidence-based care in a well-managed and designed system for sure represents the real value in healthcare. Thank you.